Chronic liver failure, also called end-stage liver disease, progresses over months, years, or decades. Here are some of the causes and symptoms of chronic liver failure. Here are some of the clinical features of chronic liver failure.
Hello, my name is Dr. Yasmin and I will be your doctor for today. So what's your name?
My name is Alina Alexandrova.
Are you married?
Yes, I am married.
What's your address?
I live in Bloomberg.
Well, how old are you?
I am 50 years old.
Okay, so tell me about your symptoms. Where do you feel pain?
I feel pain in the right part of my stomach, the upper part.
Okay. And do you have fever?
No.
How about your appetite?
My appetite is low.
So you don't eat much food?
Yes, exactly.
And then do you feel any weakness?
Yes, I do feel weakness.
Do you experience any gum bleeding?
Yeah, gum bleeding.
And nasal bleeding?
Yes.
Okay, thank you. So how long have you been having this pain for?
For the past 2 years now, I've been experiencing pain, but I didn't pay too much attention to it. So recently, the pain started and it got worse. So I decided to come see a doctor.
Okay. So any past health history? Have you had hepatitis before?
Yes, I did. For the past 10 years, yes, I had hepatitis before.
Okay. Any allergies?
No.
Have you had any blood transfusion before?
Yes, I did have blood transfusion.
Do you smoke?
No, I don't smoke.
Do you take alcohol?
No.
So how has your menstrual cycle been?
During my menstrual cycle, I used to have too much bleeding.
Okay.
Yes.
Do you have diabetes?
No, but for my mother, she had a liver disease. Yeah.
Okay. Have you had any past operations?
No.
Do you have tuberculosis?
No.
Have you had stroke before?
No.
Myocardial infarction?
No.
Are you currently on any medication?
No.
Okay.
The patient has identified herself as Alina Alexandrovna, a 50-year-old female who is married and a teacher in Belgorod region. So far, the patient has complained of pain in the right hypochondrium, which may indicate problems with the liver or gallbladder. The temperature of the patient is normal, but the appetite is low and patient has weakness, nasal and gum bleeding. Patient has had this pain for the past 3 years, but did not decide on any medications until now. The patient also complains of bleeding too much during her menstrual cycle, which could also indicate liver diseases as liver fails to regulate production and breakdown of hormones. Further examinations must be done prior to diagnosis. Based on the patient's past history with hepatitis as well as her complaints, her hepatitis would have slowly deteriorated in the last 3 years, causing cirrhosis, but diagnosis cannot be confirmed yet until further examinations are done. Patient has satisfactory condition with the Glasgow Coma Scale of 15 points and an active posture, but patient is not well nourished and has a yellow tint on the skin. Yellow tint on the skin is an indication of jaundice, which occurs when there is too much bilirubin in the blood. This can be an indication of problems with the liver or gallbladder as well as the pancreas. Laboratory evaluation of bilirubin levels in the patient must be done. Based on the objective examination as well, patient has been seen to have ascites, which also could be an underlying and common problem of cirrhosis of the liver. Further examinations must be continued. The objective examination of the digestive system shows yellow color of the skin, which indicates jaundice, raspberry tongue and gum bleeding, which is usually due to deficiency in vitamin B12. This deficiency causes megaloblastic anemia and can lead to jaundice as the liver breaks down weakened red blood cells easily. This deficiency also leads to decreased hepatic detoxification, which usually progresses to cirrhosis. There is also swelling at the right hypochondrium and tenderness in the abdomen. Positive Bloomberg and Mendel signs are seen, whereby Bloomberg sign is positive when there is presence of pain upon the removal of pressure on the abdominal wall, and Mendel sign is positive when pain arises at percussion. Liver is also seen to be palpable, which is a possible sign of hepatomegaly, and there is presence of fluid in the abdomen, which also can be ascites, occur commonly in cirrhosis. The following picture shows patient's abdomen with ascites, which is due to portal hypertension of the cirrhosis. To conclude the characteristics of the liver, the patient has pain in the right hypochondrium as it feels tender and soft when palpation was done. There is also a protrusion of the liver which indicates hepatomegaly. The general inspection of the patient rule in favor of cirrhosis, especially since the result of other systems are normal. Instrumental and laboratory examinations must be done for complete diagnosis, such as serum bilirubin test, liver function test, and the complete blood count, as well as ultrasound of the liver. Based on the lab test, the platelet count is low, which is thrombocytopenia, most probably due to the decreased production of hormone thrombopoietin in the damaged liver. Hemoglobin levels is indicating that patient has anemia. Albumin levels have decreased because it is a protein made in the liver. Thus, this could be an indication of poor function and synthesis in the liver. ALT and ALKP is increased, indicating liver damage, and serum bilirubin shows an increase in indirect as well as direct bilirubin, which indicates hepatic jaundice. The ultrasound and the CT scan of the liver also shows change in the size and shape of the liver. Based on all the examinations and tests done, it can be concluded that patient has liver cirrhosis with complications of portal hypertension and liver failure. The medical treatment given to patient is propranolol, a non-selective beta blocker, which is effective in the prevention of varicose bleeding and rebleeding, which commonly occurs in portal hypertension. Patient is also given isosorbide mononitrate simultaneously to reduce portal pressure. The surgical treatment here is for patient to undergo liver transplant. The reason as to why patient would require a liver transplant is because patient has lived with hepatitis which have progressed into cirrhosis over the years, which is the scarring of the liver tissue. When scarring occurs, it replaces the normal liver tissue and causes liver function to be improper, leading to liver failure as well. Thus, transplant is necessary in this condition. Patient should not go into surgery with the condition she is in pre-operation. In order to correct the conditions as shown in the results above, this can be done by firstly through administration of platelet, which is given as a damaged liver often lead to decreased production in hormone thrombopoietin in the liver, causing thrombocytopenia. Vitamin K is given to correct coagulopathy in cirrhosis patients. Cryoprecipitate and FFP is also given for that purpose in order to stabilize patient in liver diseases prior to surgery, improving their INR values. Lab test results of patient after surgery should be stabilized and normal.